Over a period of time, this can develop into a big hiatus hernia, and half of the stomach or more than that itself sometimes can herniate up into the chest. Hi, I'm Dr. Deepak Subramanian from Chennai Gastro Care. There's an entity called hiatus hernias. Hiatus hernias are basically, I'll just explain to you the normal anatomy, then you'll understand hiatus hernias. Normally, food we eat through the mouth, it goes through this passage called as the esophagus or the foot pipe and then enters into the stomach. Now, normally there's a valve in the lower end of the foot pipe just between the esophagus and the stomach. Now, the sphincter muscles there, if they are lax, then people develop what is called as a gastroesophageal reflux disease. And if the sphincter is very lax, then part of the stomach itself herniates up into the chest, and that is called as a hiatus hernia. Now, somebody having a hiatus hernia will probably have symptoms like recurrent belching, they'll have a lot of heartburn, they'll feel like as if there is a lot of food regurgitation, they'll feel throat pain after waking up in the morning. So these are all common symptoms that hiatus hernia patients or reflux disease patients have. So one must always be aware of these symptoms, because sometimes people may think that it's just simple gastritis and then they may be taking over-the-counter medications. Over a period of time, this can develop into a big hiatus hernia, and half of the stomach or more than that itself sometimes can herniate up into the chest. So it is important to identify that whether you have one by doing an endoscopy or sometimes scans like CT scans of the chest or the abdomen. Once this is done, a simple treatment can be employed, which may include just lifestyle and diet modifications in simpler cases. In cases where there is a big hiatus hernia or reasonably big hiatus hernia, you may have to go for a surgery like a fundoplication, where the valve that I told you, which was weak, is corrected by wrapping the stomach around the lower part of the esophagus, or rather we create a new valve which can act as a sphincter for you. So one must be aware of the symptoms and take treatment at the right time for these hiatus hernia problems. Otherwise, it can lead to much bigger issues. Thank you.